Tendinitis, tendinosis, or tendinopathy? Which one is it? Whenever somebody used to complain of tendon problems, we used to say that they had tendinitis. We used to say that they had tendinitis in their elbow, in their shoulder, patella, or in their Achilles. The idea was that inflammation was what was causing the pain. So if we could reduce the inflammation, we would reduce the tendon pain. However, further research showed that some people with tendon problems didn't actually have any inflammation. This is where tendinosis came from, which means that there was degeneration in the tendon. What they found was that some of the tendon cells had been damaged, and so the idea was that degeneration of the tendon fibers was actually what was driving tendon pain. However, more research has kind of complicated the whole picture. Some people will have some inflammatory markers present, some won't, some will have extensive damage of the tendon, and others won't. Now we refer to tendon pain as tendinopathies. Tendinopathy is really just a broad umbrella term used to describe all tendon pain. The current theory is the continuum theory, which was proposed by Jill Cook and Craig Purdom. The continuum theory of tendinopathy broke tendinopathy into 3 different stages. There's a reactive tendinopathy, a tendon disrepair stage, and then a degenerative tendinopathy. The reactive tendinopathy generally occurred when somebody would increase their activity level very suddenly. So this would be someone who hasn't been running for a long period of time and decides to run either a half marathon or a marathon and then develops some Achilles tendon pain. What occurs in a reactive tendinopathy is that the sudden spike in loading causes the tendon to build more tendon cells very quickly. And so there's swelling that occurs in the tendon, which separates the fibers. With adequate rest, the swelling goes away and the tendon returns to a normal tendon again. If we continue to overload the tendon through the reactive and disrepair stages of tendinopathy, we can have a degenerative tendinopathy. In this stage, there's extensive disorganization of the tendon fibers. We can also have a little bit of degeneration of those tendons, so they'll start to break down. And also we can have what's called neovascularization. So there will actually be new blood vessel growth inside of the tendon. As our knowledge about tendon pain has improved, the treatment approaches have also changed as well. In a reactive tendinopathy, the treatment emphasis is on load management. As discussed before, generally reactive tendinopathies occur because we've had a sudden increase in loading, so we'll want to decrease the load that we're placing on the tendon. The 3 main ways we can do this are decreasing the intensity, frequency, or duration of activity, or any combination of those 3. If we look back at the runner, we can either change how frequently they run. So let's say they're running 5 days a week, we can reduce it down to 3. Or if they're running 5 miles every time, we could decrease it to 3 miles. And so we just want to find where the tendon can tolerate the load, because we don't want to completely offload the tendon as well. If we completely offload the tendon, we can have what's called stress shielding, which is where the tendon will actually start to weaken because it's not getting sufficient load on it. So for a reactive tendinopathy, it's really about balancing loading the tendon enough and not overloading it as well. In a degenerative tendinopathy, our main focus is on increasing the tissue capacity, which means that generally we're just trying to strengthen the tendon enough to tolerate the load that we're placing on it. The changes in a degenerative tendinopathy are generally permanent, so any of the tendon cells that have died, they won't actually regrow. But if we load the tendon some more, we can stimulate the tendon to build more tendon cells around it. For the rehab of a tendinopathy, we generally want to start with isometric contractions. An isometric contraction is where we contract the muscle, but the joint actually doesn't move. So for biceps, if I'm pressing and trying to flex my arm, but I'm not letting my elbow move, that's an isometric contraction for the biceps. Generally, we want to hold these contractions for somewhere between 30 and 45 seconds for 3 to 5 repetitions. These isometric contractions have actually been shown to have a pain relieving effect for tendon pain, so we can actually use them pretty early on in the rehab program. Once the tendon is able to tolerate isometric contractions, we can progress to concentric and eccentric contractions. A concentric contraction is when the muscle contracts and the muscle shortens, whereas an eccentric contraction, also known as a negative, is where the muscle is contracting but it's lengthening. So for the biceps, if I'm doing a bicep curl, this would be a concentric contraction, and then this would be an eccentric contraction. For the treatment of tendon pain, eccentric contractions have received a lot of attention because they've been shown to be pretty effective in the rehab program. However, it doesn't seem that we need to avoid the concentric phase of muscle contractions, as there's no reason to do this. So when we're building a program, we can do both the concentric and eccentric phases of contraction and just strengthen the tendon through the full range of motion. The final phase of a rehab program would be to introduce plyometric exercises, which is where we're going to load the tendon with a quick amount of load. Plyometrics aren't always needed as part of a rehab program, it just depends on what our goals are after rehab. So if we're playing a lot of sports that are going to require either jumping, quick cutting, or any sort of explosive type of movements, we'll want to do plyometric exercises as part of our rehab program to prepare for return to sport. Because plyometric exercises put a lot more load on the tendon, we'll want to make sure that we have adequate rest after each session to allow the tendon to adapt to the load. Typically, we want to put somewhere between 2 and 3 rest days in between each session, as this will allow the tendon to adapt to the load that we placed on it. Thank you guys so much for watching my episode on tendon pain. I hope that you guys found this information useful. If you did, please be sure to like this video and don't forget to subscribe to my channel.